Ask an expert.
Hi, my name is April Warren, and I'm a senior technical advisor at Apt Associates. And today I'm here to answer a few of your questions about the role of social enterprises in global health. I think it's a super exciting topic in general, and especially in light of the current pandemic, when we need to find new ways to adapt healthcare. So before we get started, I want to just quickly address what is a social enterprise. There are a lot of different definitions out there, and I think there's two things that are important to keep in mind. The first being a focus on social impact as part of an organization's core business. And the second is to be pursuing or have a revenue generating business model. So to me, that's what a social enterprise truly is. So to answer our first question is, what are some ways that social enterprises are transforming access to healthcare and adapting to COVID-19? So we recently did a landscape analysis and looked at social enterprises across low and middle income countries. And we found that there's three key areas in which social enterprises are innovating. The first is in delivery of healthcare products. So think direct to consumer delivery of medicines. The second is in healthcare services. And that is really the key topic there is telemedicine, bringing doctors and specialists to remote areas and making it easy for both patients and doctors to stay home and stay safe. And then finally, in the delivery of healthcare information. And here I want to talk about a social enterprise called Nivi, which operates in India and Kenya. Before COVID-19, they had an AI-powered chatbot, Nivi, that provided confidential and on-demand information about reproductive health. And in response to COVID-19, they found that their users were having more access issues with getting to facilities and getting the information and services that they needed. And so what they did is they built additional content into their platform so that they could provide information about healthy practices during COVID-19. And then they also built partnerships with e-pharmacies to be able to help their users navigate healthcare during this time. So moving to our second question is about how social enterprises can tap into and strengthen existing local savings groups to mobilize more resources for essential services. And so I think this is a great question, and it immediately brings to mind a social enterprise I know in Kenya called Afia Research Africa. They deliver healthcare in poor and rural communities, and they do this sustainably by co-owning and co-operating their healthcare facilities with local savings groups. And so essentially they help to strengthen and formalize the financial services enterprises that these women's groups and savings groups operate. And then the revenue from that enterprise is able to cross-subsidize the cost of healthcare, as well as generate additional income for the women and community members. So unfortunately, that's all I have time for today, but thank you so much for tuning in, and please continue to ask questions on Twitter using the hashtag AskApt. I can also be found on Twitter at AE Warren. Thank you so much.